Minister of Health Dr. Frank Anthony, in response to a question raised by a news entity on Tuesday on how soon should persons access a second dose of a COVID-19 vaccine, pointed out that the existing protocol should guide persons to return to the vaccination site within 8 to 12 weeks after being administered the first dose of the AstraZeneca vaccine.
For the AstraZeneca vaccine, that we are using this longer interval between first dose and your second dose. And with that longer interval, we'll see the efficacy of the vaccine going up. And that's what we want for the persons, the citizens of Guyana, to have a better effect with the vaccine. And just by changing the time interval, we can have that better effect.
He noted that recipients who appear for the booster dose sooner than the stipulated time frame will be denied the shot.
We have a very standard protocol, so we're not going to encourage anybody to come before the time. So part of the process, when you come to one of the vaccination sites, the nurse or the clerical staff that is working there would explain to you what vaccine you are getting. They will enter that into a card, and then they would put the date when you got your first dose, and then put the date when you're expected to come back for your second dose.
The ideal interval for China's Sinopharm vaccine, which is also being administered to the elderly population, is being touted as 3 to 4 weeks. Meanwhile, despite clearance from the World Health Organization, the Caribbean Public Health Agency, and other regulatory bodies, several European countries, more recently Germany, Italy, Spain, Ireland, and France, have suspended the use of the AstraZeneca vaccine over safety concerns. Austria, Norway, Denmark, and Iceland followed suit after reports surfaced that recipients of the vaccine had developed blood clots. Neighboring Venezuela, though anticipating several doses of the vaccine soon through the COVAX mechanism, has not authorized the vaccine for the inoculation of its populace. Local health authorities have maintained that Guyana will continue to immunize Guyanese with the vaccine until one of the reputable regulatory bodies say otherwise. Currently, the vaccine is being utilized on healthcare workers and persons 60 years and older. Meanwhile, on Tuesday, Minister of Housing and Water Colin Crowell became the latest parliamentarian to access the COVID-19 vaccine. He reiterated the call for other citizens to do same. To date, President Irfan Ali, Vice President Bar Jagdeo, Prime Minister Mark Phillips, and other members of government, as well as from the main opposition party, have taken the vaccine. Temika Rodney reporting for the H.